We've decided that we've concluded the consultation process and that we're going to proceed to explore implementation of the reconfiguration proposals in a full business case. That will be necessary in order to secure the required funding and also be necessary to complete the process.
The next steps are mainly meeting with the Joint Health Overview and Scrutiny, which will happen in the next couple of weeks. You'll be aware we've got these 19 recommendations that they've made to us. We feel that the majority of those we can work with, but there is some that we will need to have a conversation with them. Following that, we would then be working with the Trust and with other key stakeholders to start work on the full business case. That would be the plan.
The local NHS is unsustainable in its current form. The service is stretched between the two towns, so close together compared with a lot of places in England, so close together, and yet trying to duplicate old general hospital standards. Really, our model is about 20 years out of date compared with a lot of places, and it's actually unsustainable, and it doesn't produce the results that people deserve.
This process started about 4 years ago. Our local trust, Calderdale, Huddersfield, were having some quality and safety concerns, and most of these have come from trying to run essentially two hospitals and having duplication of services. So they came to us saying, we need to work out a better way of doing this. So quality and safety concerns. The model that we have proposed, where we're essentially centralising services onto one site, is what we think the best way to address these quality concerns. Alongside that, there have been workforce issues. We know they're having trouble recruiting and retaining staff, again because the current hospital environments are not all that pleasant to work in.
We understand how unsettling significant changes are to services. Unfortunately, we've got a bit of a backlog of change needed in our local system. That's why it feels such a big step. It is a significant change. We have said all along we wouldn't propose anything that we didn't believe would improve the care of patients, and we still don't feel that we've been pressed into suggesting anything that won't improve the care of patients. So that is the main priority, and I'm confident that it will actually achieve that.
My message for the public is give us time. We are fully committed to explaining and illustrating what these new proposals mean to them. They need to trust us. Ultimately, this has been put forward by doctors, by local GPs, local hospital doctors. We passionately believe these are the right things to do for our healthcare system. And when they start seeing it in action, I'm sure they'll believe us.